Hey everybody. So it has been a long time since I posted. Um, I am, let's see, about a year and almost 3 months post-op with Dr. Agarwal. So I wanted to make an update about that because I didn't make a 1 year update. So, uh, before that, though, finals have been crazy for me. I changed my major, so, well, sort of, I added a major. I am now doing forensic anthropology and human biological sciences, so that's intense. And I'm working at a youth home and the Montana State DNA lab, so that is all really exciting too, um, because they took my DNA, obviously, to work at the DNA lab, um, and so they know that I'm trans because of my DNA, so that's pretty cool because none of them really care. Uh, they're all pretty open, and they hate Trump, so I feel pretty safe there. So, I guess with that being said, I can talk about my transition a little, maybe, I guess. Uh, I got married in May to a genderqueer writer, uh, formerly using male pronouns, but just recently decided to use they and their pronouns. So, yeah, there's that. um, we're really happy. And we have 4 cats and 1 dog. And yeah, things are good on that side. As far as school, I'm so ready to be done. I have 2 finals tomorrow, and then I'm done with this semester. And then we'll see where it goes from there. I may study abroad. I'll let you guys know about that if I do. Uh, there's an opportunity in Belize where I can possibly study ancient Mayan skeletal remains. As far as my transition so far, I am, let's see, about, in February, I'll be 4 years on testosterone. And on Christmas Eve, I'll be a year and 3 months post-op. So, last year in September, I had my surgery with Dr. Agarwal in Salt Lake City. She's really awesome. It took me a while to find her because there's not much stuff about her, but she is really great, and she's not very expensive for people that are worried about the money aspect. The whole thing was great. Like, even my fiance at the time was accommodated greatly. Like, they were like, "Do you need a drink? Do you need some snacks? Um, what can we do for you?" Because I was out, and I didn't even know that I was out for that long. I walk into the operating room, and I'm talking to everybody, and then all of a sudden, some nurse is waking me up, and I didn't even know how long I was out. And even after surgery, I felt really great. Like, I didn't have any problems. I wasn't really in pain. I took the pain medication because I was afraid of, like, becoming in pain because I knew how bad it was. like because I was cut all the way across, where some surgeons only cut like on the sides, I guess. I don't know, but I'll show you what it looks like a year afterwards. Um, I don't remember if I did a 6 month update, but uh, I feel like a year is really the best indicator anyway, because 6 months, like you're still healing, so that's not really what you're gonna look like in the long run. Um, so for a year, it's a pretty good indicator. Like your scars are still gonna fade a little bit through the next couple years, but I feel like most people after about a year are the most comfortable without their shirts on or anything like that. So, here we go. So, 1 year post-op with Dr. Agarwal. Um, I'm super happy with my nips. Um, like I said, she cut all the way across, so like you can't see any of these scarring. I feel like even if the hair wasn't there, you wouldn't be able to see it. It's still a little bit dark on the sides, but I really think those are going to go down in the next year, maybe 2 years. Yeah, I'm really happy with it. Uh, there's no like weird, like extra skin. If anything, I think that there was a little bit too much fat taken out right in this area, but that's nothing that like working out wouldn't do. I just have not been. I've had no time with having two majors to be able to do that. So, yeah, I encourage everyone to go to Dr. Agarwal. If you have any questions about her, I can totally hook you up. Um, I know her nurse's email address, so I can put it in the link for you guys. I think total. Let me remember. I believe I paid 5,600 for my surgery. So, if you like the results that I have showed you, then you should definitely contact her. She is great. If you talk to her on the phone, when I talked to her, I felt so much better. Like, I had never had surgery like that before, like a major surgery. I've only ever had my wisdom teeth out, and I was totally like, I was nervous. Even though I knew that in my heart that top surgery is what I wanted to do, I was still super, super nervous. And she was awesome. Like, she made me feel comfortable, and like that was okay to feel nervous, where I feel like a lot of trans people are like, if I'm nervous, then this must not be what I want to do. Like, is the surgeon gonna judge me because I feel scared or whatever? But she's not this way, and that's, I think, a big thing in this community especially. So uh, even if you're just considering and you're not sure who you want to go with, I think you should talk to her because she's really great with listening to you. What She's really great with listening to you, finding out what you want, and telling you what she can give you based on what you want. So she'll tell you straight up, like, that's not going to happen. And yeah, she'll also be like, this is what I can do with what you've shown me. Because she'll ask for pictures before you have a consult with her. You don't have to show your face or anything. You just send her frontal, and side pictures, and she can tell you exactly what she should be able to do. The next step is once you set up all your appointments and you go in to see her, then she will look at everything and she can tell you, I can do this, and these are the results you're going to get. So I like that she's very straightforward. She's not like the kind of surgeon that's going to be like, yeah, I can definitely do that for you, and then you're going to be disappointed later. She'll tell you straight up if she can't work with what you've got. So just saying, I think that's really important, especially when it's something like this, where it's hard to find surgeons in general. So yeah, here's my 1 year and 3 months update. Still a little dark on the sides. They are completely flat. They're not like bulged or anything. It's just the coloring. I think my nips look pretty good. Yeah, and as I said, like, the scar is from, I think, right around here, and it comes all the way down, and you can't see it at all in the middle anymore. I have to look really hard to be able to see it, honestly, until about right here on both sides. And I think that's pretty sweet for being 1 year post-op. I mean, I see a lot of people that are 3 years and you can still see their entire scar. So yeah, this was my update. If you like it, then that's awesome. If you have any questions, I'm here. And I'm totally a big advocate for Dr. Agarwal. So let me know if you have any questions about that. Right now I'm in the process of getting a letter from her about having a sex-altering surgery so that I can send a letter to the state of Illinois, where I was born, to change my birth certificate, because I'm thinking about studying abroad and I need to be able to change my passport. So that is my process right now. I think in the future I'll probably post about having lower surgery, but right now I'm not really at that point. So I'll get there when I get there. If anyone has any questions, I'm totally here to answer them. I actually would like to give away some binders that I have left over. I think there's 3. So comment below if you want them, and I can message you and get your address or give you my email or something, we'll get in touch and I can send them to you for free because I obviously don't need them anymore. I have two that are the almost, I'm sorry if this is triggering, but they're almost sports bra like, where they come over the top and they attach with Velcro on the side. I have two like that. And then I have one that's just over the top that is GC2B, slightly stretched out. I think it's a medium, but I think all three are a medium. But either way, I want to give those away to anyone that may need them. So let me know if you're into that. Yeah, thanks for watching. That was Joel. If you saw that kitty tail in the back. This is Joel, our newest baby. He's about 5 months old, and he's a butthole, but I love him. Yeah, contact me, let me know. I'm here to help. Literally, the reason that I post these pictures or these videos is to help people. Like, I'm not posting it for any other reason, really. Like, I want to be able to help our community. So let me know, and thanks for watching. See you guys.